It's time now for your weekend wellness, and we start with a new study on the impact of microplastics, which found human brains contained as much plastic as a plastic spoon, which is up 50% from 2016. Fox News medical contributor Dr. Nicole Saphier joins us now. Doctor, thanks for being with us. Okay, so I read this, and that sounds awfully scary to me. And I was talking with my wife last night, like, do we need to get rid of all the plastic stuff in our kitchen? What do you make of this?
Well, good morning, Brian, and happy Mother's Day to your
Likewise.
wife and my mother as well. You know, microplastics, I've got to be honest with you, Brian, they make me a little concerned. And a lot of this is because we're looking at cadaver or postmortem autopsy studies. And what we're finding is in the brains of people who have dementia, there's actually higher amounts of microplastics. So essentially, these microplastics, or these tiny little particles of plastics, are crossing the blood-brain barrier, and they're depositing into our brain. And they're being correlated with increased risk of neurodegenerative diseases like dementia, possibly linked to autism and other things that affect the brain. There's also evidence showing increased risk of stroke and increased inflammation overall. So I have always said, listen, there's no way to avoid microplastics entirely unless you're going to live in a bubble. And by the way, that bubble couldn't be a plastic bubble. It'd have to be a glass bubble. But there are some things that we can do to decrease our exposure to microplastics. And one of the big things is you want to cut out those tea bags. I'm a big herbal tea drinker.
Oh, no.
I love tea. You want to be using loose leaf tea because tea bags actually have a lot of microplastics in it. In addition to that, get away from those plastic cutting boards that you may have in your kitchen, because if you're cutting your fruits, your vegetables, your meats on that, you're getting pieces of plastic in your food. Well, plastic water bottles, that's a big one, unfortunately. If you can do away from plastic water bottles, get glass. Same with stuff that you store your food in. Don't microwave plastic, and try to filter your water because there are microplastics everywhere. And so when we're talking about brain health, after the age of 55, about 42% of people have a risk of dementia. Good news is we're seeing a decline in dementia rates. However, dementia is incredibly prevalent in our society. So it's important that you do everything you can to preserve your brain health before you hit start seeing signs of dementia. And even if you have early signs of dementia, you want to do what you can to preserve that brain function. Yeah. One of the best things you can do, keep exercising, because getting that blood flow to the brain, very important. Maintain socialization, talking to other people. That stimulates your brain, doing puzzles. Prioritize sleep. Sleep is so important, Brian. You've heard me say it so many times.
Yes.
And also, you are what you eat. Make sure you're eating foods high in choline, like salmon, eggs, lean chickens, lean proteins. And also, you know, I love my natural herbs, whether it's Bacopa monnieri, ginkgo biloba, ginseng, rosemary, sage. Incorporate all of this into your diet, or try and take some supplements to help with your brain health.
Okay, those are great tips, and I have got some changes to make in my life, doctor. No question about that. But I got to ask you about this as well. So Vanity Fair is out with a new piece basically saying that the American obsession with protein is a mega problem. What do you think about that?
I don't know why everything has to be political, okay? Let's just talk about diet. First of all, I have always been against fad diets. I hate extremes of everything. I am one of those everything in moderation kind of people. But when you're talking about, you know, the keto diet, the paleo diet, these really high protein diets, they're great when it comes to losing weight, because if you're cutting out those sugars and your carbs, absolutely, you're going to be burning that fat. And that's what people want to do instead of taking a GLP-1 injection. They're actually trying to change their lifestyle, which I'm all for. However, these high protein diets, in my opinion, is long term, they can have some negative consequences. So you want to have a variety when it comes to what you're eating. You absolutely want those lean proteins. They're essential for your muscle mass, especially in women as you get older, perimenopausal, menopause. You need protein to keep your muscle and your bone strength. But you also, if you only eat meat and you're cutting out the fruits and vegetables, you're not getting the fiber, you're not getting the antioxidants, the folate, and everything else that is so crucial to our health. So everything in moderation, Brian.
Okay.
Let's have a variety in the things we eat and avoid all that ultra-processed crap.
Doctor, your tips are the best. Thank you for those, and a very happy Mother's Day to you indeed.
Thanks for having me, Brian.
All right, good to see you.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.